Hello, I'm Dr. Rohit Sood. I'm with Ironwood Cancer and Research Center. I've been a physician here for 6 years now since I moved to the Valley from the University of Rochester, where I finished my training. As you might well be aware, March is Colon Cancer Awareness Month, and colon cancer is the third largest cause of cancer diagnosis that we see in our clinics here at the Ironwood Cancer and Research Center. It's a very important topic that I'm happy to be talking about. I get asked in my clinic, what are the symptoms of colon cancer? What should I have felt, doctor? And colon cancer is a diagnosis that most patients don't actually feel anything before it is diagnosed for some other reason that they have some imaging done for. But many patients experience pain, bloating, some alteration in their bowel habits, maybe a change in the color of the stool, maybe a change in the shape of their stools, or some blood in the stools. Sometimes some patients tend to have iron deficiency anemia that leads to a diagnosis. So it's very important to check in with your doctors if you have these symptoms. Screening colonoscopies are extremely important, and their importance in identifying this diagnosis before it actually causes any symptoms cannot be reiterated. Many times patients ask me, what is the contribution of my diet and what can I do to actually minimize the risk of colon cancer occurring? Most cancers that we see occur because of genetic mutations. Our cells mutate all the time, and some mutations are good and are kept by the body, others are rejected. But sometimes certain bad mutations persist and cancers are formed. But most cancers are random and they can be detected by early colonoscopic interventions. So talk to your doctors and so that they can assess your risks as to what your genetic inheritance pattern is, and give you good advice about when to do colonoscopies. The other important thing is, what can you do to decrease the risk of colon cancer? Exercise has been shown to decrease the risk of colon cancer. Keeping yourself physically active and fit, high fiber, low fat diet also decreases risk of colon cancer. There is some data about calcium and vitamin D decreasing the risk of colon cancer as well. If you're above 50 and if you have any risk of hypertension or stroke, talk to your doctor about a baby aspirin. That has good data showing decreasing the risk of colon cancer as well. And I cannot again emphasize the need for prompt and timely colonoscopies, which I definitely encourage that you discuss your risks with your primary care physician and get to a gastroenterologist so that you can keep away from the office. For further information, please visit our website www.ironwoodcrc.com for further details. Thank you.